You're watching this film because you've had coronary artery bypass graft surgery. The film will provide you with some facts about coronary artery disease, your surgery, and will offer information about your recovery, including healthy lifestyle advice and the importance of cardiac rehabilitation. Your heart. The heart is a powerful muscle that pumps blood around your body. To keep your heart healthy, it needs a good supply of blood containing oxygen, which is delivered by the coronary arteries. At birth, your arteries are wide open, but over the years, fatty deposits can lead to plaque buildup in the walls, known as coronary heart disease. For some people, this process happens without causing any symptoms, but for others, narrowed arteries can cause symptoms of angina or potentially lead to a heart attack. Your surgery. Coronary artery bypass graft surgery is used when one or more of the coronary arteries in the heart have become significantly narrowed or blocked. During surgery, blood vessels from elsewhere in your body are taken and attached below the narrowed area, bypassing the blockage. This means that the blood flow to the area of heart muscle beyond the narrowing is improved, and this increases the oxygen supply to the heart muscle. If you had valve surgery as well as bypass grafts, this will have involved a repair or replacement, usually of the aortic or mitral valves. The replacement valve will either be biological, made from animal or human tissue, or mechanical, made from metal or plastic. Early recovery. When you first return home, you will feel physically and mentally tired. This is normal. After heart surgery, your recovery may appear slow. It may be helpful to think of your progress week by week rather than on a daily basis. It will take time to re-establish normal routines, regain your confidence, as well as regaining your usual appetite, sleep patterns, bowel routines, and for pain to settle. In the early days of your recovery, it's important to keep active, and you should continue to build up your walking, starting with the level you were at when you were discharged from hospital. Start by walking at a pace which allows you to walk and talk comfortably. Once it feels easy, you can increase your walking and do a couple more minutes each time. Keep progressing your walking distance when you feel ready. Fatigue can be a normal part of recovery, particularly in the first few weeks. Listen to your body and try to keep active within your limits. The fatigue will gradually lift during the first few weeks of recovery. Remember to follow the move in the tube guidance and avoid heavy lifting, pushing and pulling activities for 6 weeks after your operation. It's natural to feel a bit nervous about exercising after heart surgery, but remember, the heart is a muscle, and like any other muscle in the body, it needs exercise. When exercising, it's important to pace yourself and include a warm-up and cool-down. A warm-up means building the pace up slowly when you start to exercise. This helps prepare the body. Cooling down means slowing down gradually when you're finishing exercise and avoiding a sudden stop. If you're not feeling well, it's important to have a rest day. And if you continue to feel too unwell to exercise, you should seek appropriate medical advice. Ultimately, exercise should be a habit for life. Try to find something that you enjoy doing, as it will be easier to keep going. Your cardiac rehabilitation team should be able to guide you on how soon you can return to other activities, such as golf, swimming, racket sports, and cycling. These all need additional consideration while the breastbone is healing after your surgery, and you may be advised to wait up to 12 weeks after surgery before starting these activities. Exercise will keep your heart in good condition, and getting out into the fresh air will help you feel better and lift your spirits. Emotions. It's not uncommon to feel anxious after heart surgery. In the early stages of recovery, you might be anxious or worried about not being able to do as much as you did before. You might feel frustrated that your recovery is not as quick as you would like, and about having to rely on others to help out. Your family members may also feel anxious about your well-being and recovery. These are all normal reactions. You can expect to have good days and bad days. If you're experiencing some of these emotions, it's important to talk about them. If it's fear for the future or you think you might be anxious or depressed, talk to your GP or your cardiac rehabilitation team. They will be able to support you and refer you for psychological support. Cardiac rehabilitation can also help to relieve anxiety and set your mind at ease. Risk factors. There are several risk factors which put people at higher risk of developing coronary artery disease. However, if you take your prescribed medication and follow a healthy lifestyle, your risk dramatically reduces. Some people who already have a healthy lifestyle will gradually return to their normal routines as they progress through the recovery period. Some people might be keen to make positive lifestyle changes, and your cardiac rehabilitation team can help to signpost you to useful information and websites, as well as supporting you in making those changes. Some risk factors you can't control, such as family history, age, gender, and ethnicity. However, many risk factors are related to lifestyle and can be controlled. These include smoking, eating an unhealthy diet, and not exercising enough. If you're a smoker, no matter how long you smoked for, quitting can help improve your health straight away. Stopping smoking is the single most important step you can take to reduce your risk of developing heart disease. Smokers are almost twice as likely to have a heart attack as people who've never smoked. There's support available to help you quit. You can ask your GP or local pharmacist for advice and support. Immediately after your surgery, the idea is to eat a bit of what you like until you get your appetite back and have the energy to focus on a healthy diet. In the long term, it's important to aim for a healthy, balanced diet, including eating more fruit and vegetables. You should cut down on saturated fat, sugar, and salt. To get the vitamins and minerals your body needs, you should aim to eat a variety of at least 5 portions of fruit and vegetables a day. They can be fresh, frozen, dried, or canned. Along with fruit and vegetables, bread, potatoes, rice, pasta, or cereals should make up the main part of your meal. And wherever possible, try to eat whole grain varieties. Try to include oats, beans, and pulses in your diet, as these, along with fruit and vegetables, contain fiber, which helps to lower cholesterol levels. Try to cut back on things like cakes, biscuits, and pastries, which are higher in saturated fats. You can also lower saturated fats by including low-fat dairy products in your diet rather than full-fat. However, be aware of low-fat products that are high in sugar. High sugar intake is another risk factor for heart disease and can lead to excessive calorie intake, weight gain, and raised levels of blood fats. A lot of people enjoy drinking alcohol. To keep alcohol risk at a low level, the guidance is not to drink more than 14 units a week on a regular basis for both men and women. Keep consumption to a maximum of 2 to 3 units a day, with a couple of alcohol-free days per week. Cardiac rehabilitation. Cardiac rehabilitation programs are designed to offer support in making lifestyle changes, as well as helping you rebuild confidence so you can resume the activities you enjoyed before. You will be referred to your local cardiac rehabilitation service, and this is usually based on postcode. The types of service will vary depending on the area you live in and the type of surgery you've had. Cardiac rehabilitation programs can include telephone support, home-based, digital, and group-based exercise and education classes. Your local team will let you know what they offer. Cardiac rehabilitation is offered to people who've been treated with coronary artery bypass grafts. Programs and support vary for other cardiac conditions. Importantly, cardiac rehabilitation is as much a part of your treatment plan as your medicines. It aims to give you the information you need to look after your heart health and keep you well in the future. Undertaking a cardiac rehabilitation program, whether home-based, digital, or class-based, is a good way of supporting your return to activities, routines, and psychological well-being after surgery, as well as reducing your risk factors for further heart problems. When you reach the end of the program, it's important to make sure you continue to make time to be physically active on a regular basis. Depending on availability, you may be offered the option to be referred to your local cardiac fitness class. These are run by fitness instructors who've done training to understand more about exercising with cardiovascular disease. Your cardiac rehabilitation team can provide further information about this service. Thank you for watching this cardiac rehabilitation film.